All right, welcome to the Beasley Equine Podcast. I'm your host and equine veterinarian, Dr. Travis Beasley. Today in the studio, we have Jenny Buchanan, a third-year vet student at the University of Illinois College of Veterinary Medicine, who also happens to work at our clinic on break and on summer. We're going to dive in and see what vet school is like now, what made her pursue this career, and what she's planning on doing afterwards. And we took over the Just Say Hey studio, so we want to thank all the guys over there for letting us use this place. So stay tuned and we'll dive in.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin.
All right, Jenny, good to see you again.
Good to see you. Thank you for having me.
You bet. How is vet school going?
Vet school's going good. I'm looking forward to the end, coming up on approaching less than a year, but this last semester was definitely one of the hardest yet for my vet school career.
Yeah, that's third year, right?
Yes.
Yeah, they all are terrible in their own way, right?
Yes.
Yeah, so it seems hard to say, but it's been almost 15 years since I was in third year, and I've forgotten most of everything about it. So is this surgery year or is that second year?
This is surgery year.
Okay. And that's when you guys spay and neuter shelter dogs and cats?
Yeah, so the first 8 weeks we have normal class like we do the other years of vet school, but the second 8 weeks we start what's called junior surgery, where we get to spay and neuter shelter cats and dogs. And then this coming spring, when I start back for another 8 weeks, I actually get to continue that, and I also get to do a equine junior surgery lab where we get to castrate horses as well.
Oh, and they're probably feral ones.
Yes,
Oh,
very few are actually halter broke.
Yeah, that'll be fun. So what made you want to go into vet school or the veterinary medicine profession to begin with?
I have always had a really strong passion for animals, and I knew I wanted to be a vet since I was in third grade. I don't know that I actually had like a true deciding factor. I just knew that's what I wanted to do, and it aligned with what I like to do. To me, veterinary medicine isn't necessarily like, oh, I have to go to work, but they say it's not work if you like what you do, and this is something that I truly like to do. And I think it's really nice. Part of the reason that I chose to do veterinary medicine was my passion for animals in our rural area and our need to have vets here.
Yeah, there's quite a shortage in places like this that we see every day, people calling the horses we can't get to or other people can't get to. So I think that's great. Is there very many people in your class going into large animal or rural areas?
No, I would say there's probably about 155 in my class. Maybe about 20 are going to go into rural areas.
Oh, wow.
Or large animal in general.
Yeah, how many of those are going to do horses, do you know?
Horses only?
Yeah.
Oh, maybe 5.
Really? And a lot of the statistics show is after vet school, a lot of the people that track only equine, they end up changing within the first 3 to 5 years.
Yes.
And go into small animal, or some never even go back to the profession at all. So I think that's, when I went through, I think there was 110 of us in the class, which was too big a class for what the school could handle. There's 155 in yours?
Yes, it's still pretty big, honestly.
Yeah.
Our classroom is pretty packed on exam days. You don't have that much space, and you don't get as much one-on-one when all of the students are there. Like anatomy, our first year, this was like one of the first years that they actually increased the class size. I think the class above me is about 130, 140, so they bumped it up quite a few. And it was a big change for some of the professors in anatomy to get around to all the students.
Yeah, because the one-on-one is so important for anything you're learning. But, man, that many vet students, that seems wild to me. Why do you think they let so many in?
I believe they let so many students in because there is a need for veterinary medicine, and especially in rural areas, but the amount of number of students that are actually going in to rural medicine doesn't equal out the number of students that they're letting in.
Yeah, so maybe they don't need to increase the number of who they let in, but who they let in.
Very true.
Yeah, and that's been kind of a common theme lately with this, especially with the shortage of the equine vets. What So if you don't get much one-on-one in vet school right now, you still get to do internships and externships during school, correct?
Yes, so Illinois is actually unique. We're not a 2-and-2 program, but we're not a straight 3-year, 1-year program for clinics as well either. In the first 8 weeks, you get 16 weeks of clinics your first and second year. So 8 weeks in your first year and 8 weeks in your second year. But those all have to be at the school. So you do get exposed to clinics that way. And then you're encouraged to do externships in your summers in between first and second year, and then second and third year. And then your fourth year of vet school, when you go to clinics, you actually get a certain number of off-campus blocks where you get to go do externships.
Okay. I graduated in 2013. We were the first class where they switched to do the clinics the first 8 weeks. But from what I can remember, we just stood around and watched stuff for the first 8 weeks. Do you get more hands-on, or are you still just kind of in the corner?
You still mainly observe. You don't get much hands-on experience. They switched it now to where it's our second 8 weeks of the first semester, which is a little bit better. That way you're a little more familiar with some anatomy and questions, but you really don't actually get to touch any of the patients.
Yeah. I think it's good people get to see different stuff, but when I was applying, I remember we tried to do that before we applied to get that experience and try to kind of figure out what you wanted to do. But, I mean, I guess times change a little bit. So what's your favorite class right now?
My favorite class right now was definitely, I had an advanced equine reproductive class elective that I got to take, which definitely take all of the electives that you can because you can focus on what you enjoy more. And this elective was unique where we had lecture 1 day a week and then lab another day a week, where we actually got to get the hands-on experience that I was wanting.
Yeah, and you worked in the repro center up there, correct?
Yes, I was an assistant there.
Did you like that?
I loved it. I started working there as an assistant the spring of my first year of vet school and then have worked there ever since.
Yeah. And as we mentioned in the first episode, you've been working at our clinic since your first year, right? After you got accepted?
Yeah, the summer before I started vet school.
Yeah, and I think I told the story in the first episode, but I think your mom was at the clinic, and she said you got accepted and wanted to know if we were hiring, and I said, no, I can't afford to pay anybody else. But that first Monday you showed up to job shadow, you got put to work, and we hired you the next day.
That is very true.
Yeah, you do have a very strong work ethic, which
Thank
I think everybody will see as you're doing your externships throughout the rest of the year. So you get to go to different clinics your fourth year.
Yes.
Where do you have any planned yet?
Yeah, I do. I have several planned. The first one that I'm going to Haggard for 2 weeks. And then I will be going to Weatherford Equine for 2 weeks. And then I plan to go to Peterson and Smith in Orlando for 2 weeks, which will be nice. That's in September.
Oh, good.
And then I will actually get to come back to Beasley's Equine Clinic for 2 weeks. So I'm excited to come back and apply some of the skills that I've learned and refine my other skills. Yeah. And then I will be going to Solo Select for 2 weeks. The resident at Illinois actually graduated and is working there now. So I get to go spend time with her in Texas, breeding horses and foaling out babies for them.
And she was the one you worked with when you were assisting at the repro center up there. Yeah. So
Yep.
I would imagine you'll probably get to do a little more hands-on than they let some that they're not familiar with.
Yeah, that's one reason why I'm excited to be able to go work with her is I've already established a relationship with her, and I know how she likes to perform different skills, so I can meet those needs for her.
Yeah, that'll be fun. I'm assuming they do a lot of embryo transfers and stuff like that.
Lots of embryo transfers.
That's awesome. I did a handful when I did my internship. We were half repro, half surgery. And that was again like 13 years ago. I know they've come a long way in some of that. What have you seen as far as working in the reproduction area that's changed just in the 3 years you've done it with embryo transfer, ICSI, or anything like that?
Yeah, so I haven't got as much hands-on with ICSI, but I'm hoping I can get more of that when I can go to Texas and spend time with Dr. Spencer. At the University of Illinois, we do a lot of embryo transfer, and one of my favorite cases is I actually put an embryo in a recipient mare with Dr. Spencer and then got to full out the mare the next year and see the baby that we put in as an embryo.
Oh, that's cool when you get to see it full circle. And it's interesting with some of the repro stuff. Like, you don't, as veterinarians, we don't get to see too many normal births unless we're actually foaling out horses like that. So, like in my situation where we don't foal out horses at the clinic, I only get called if there's a disaster. So I can't even remember the last time I got to be there during a normal delivery where everything went right. So that's cool that you got to be there from the conception basically to that thing on the ground. What kind of horse was it?
It was a racing quarter horse that we put in an Andalusian buckskin mare.
Oh, cool. Does it have a name?
The baby?
Yeah.
I don't know if what the baby's name was.
Okay.
Actually.
Well, maybe they're listening and they'll name it Jenny. They haven't registered that yet. So what are some of the most important lessons or experiences that you've gotten in school so far? Would it be related to the repro stuff, or?
I feel like that's probably the most hands-on that I've got to do, and being able to have that relationship with them and them calling me to be like, hey, we have a mare foaling, and getting to go help the mare foal out, help the baby nurse, and then get to run all the normal lab values and see a healthy baby go home has been truly inspiring to me and built my passion for reproduction. However, our wards are really nice for equine, and the doctors are great. I'm on the board for the AAEP club at school, and so we have several labs with several of the doctors there, and that's also been a key builder for me, is getting to make relationships with our doctors and do labs that you don't get during school time. So you really have to put in the effort for extracurricular activities to get the skill sets that you want and need.
Yeah, it's like anything else. You kind of you get out of it what you put in.
Yes.
Yeah. So I think it was Dr. Bobrock that told me one of the most important things about vet school and all those things is building your network of people you can reach out to, because there's no way, except some of the specialists can remember everything. And I mean, I have to tell clients all the time, like, I don't really know what's going on, but I know where to look or I know who to call. And I think that's an important thing, is not knowing what you don't know, where your weaknesses are, but having those people at your disposal that do know. So building the network, I think, is really, really key. So keep that up for sure. Since your first day working with us, because you worked at a mixed animal clinic in Kentucky before you came to us, right?
Yes, I did.
Did you do many horses there? Or?
We did see horses, but it was mainly more like a colic, a laceration, Coggins, blood work. We did not do lamenesses, sports medicine. We did a little bit of repro, some castrations, but not to the extent of equine specialties that we do here.
So when you were working at that mixed animal place, did you have a focus yet?
I did not.
Okay. So have you got one now since vet school and then working with us?
Yes. I knew I always wanted to work on horses, but I didn't know that I wanted horses to be my specialty until after I came to Beasley Equine Clinic and truly discovered how much I loved it and the joy that it gave me.
Yeah. What's your favorite thing to work on at the clinic besides repro stuff?
My favorite thing is probably sports medicine, since I ranch sort and I get to compete, and being able to see people that I compete with and help them get back to what they like to do. Since
your knowledge with vet school and knowing the anatomy and how crazy horses are put together. And to me, it's always amazing that they can hold up doing anything, but they can hold up to what you guys are asking these horses to do performing. Has that made you more paranoid riding your own horses and showing and traveling?
Yes, it has made me very paranoid, especially since we see so many clients at the clinic and so many lameness exams, and you can look at a horse and know that something's off. And this summer, my family traveled to Wyoming and Colorado, and we were showing, and I just felt that my horse was off, and I didn't show the rest of the time, but I felt confident in my decision to make that for their longevity and career over one show.
Yeah, because we do get a whole mix of people that come in. Some of the more seasoned trainers or people that show is like, they know to quit if they know something's off. And those horses, if we can get there early and intervene, they tend to have a much better outcome besides the one that they, beaut them and use them.
Yeah, my horse did really well, actually. I hadn't been able to show as much this last semester of vet school like I had the previous 2 years, unfortunately. But I got to show over Thanksgiving break, and he definitely did not disappoint for me.
Good. And which horse was that?
Trapper,
yeah. He's been a frequent flyer sometimes at the clinic.
Yeah.
But he's how old now?
I think he's 15.
15, yeah.
My mom takes care of him for me, so she calls you a lot.
Yeah, that's
I think she was more paranoid when I was doing his gastroscopy than I was.
Yeah, Jenny's gotten really good at scoping horses. She's been there. Were you there both training days or just the one?
Both training days.
Yeah, I think the second one we just gave you the reins and let you scope. So that's awesome. Shout out to Dr. Hoyt Jeremy for coming in and training us the gastroscopy, which we got episode 2 of the podcast was talking about equine gastric ulcer syndrome, if you want to go back and listen to that. So you mentioned you kind of changed a little bit in your path after you worked with us. What stood out? Mainly the sports medicine stuff, or is there anything in particular?
The sports medicine was a big part of it, but I think the clientele was also a really big part of it. Our clients have been super wonderful and have also allowed me to grow in the 3 years, almost 4, that I've been at Beasley Equine Clinic. And they've been truly great with letting me work on their horses since I first got there to now. And their confidence in me has also increased and given me confidence to be able to perform skill sets like extract a tooth this last summer. I got to pull my first tooth. Thank you to Cassie for that.
Yeah, we do have some really, really good clients, and they have been really receptive to you. With my internship that I did after I graduated, they put intern on our scrubs. So when we went out on our own, we got a lot of these cowboys in Texas looking at our scrubs. Are you a vet? And a lot of people don't want just anybody working on their horses. So I think it's really good that you've been there this much and people have got comfortable with you. And I think, because you're still planning on returning in 2026, correct?
Correct.
Oh, thank goodness. But I think we can overlap and do a lot together, but I think you're going to hit the ground running, because from what I can tell, at least with some of the people that come through, and then where I was with you or when I was in your shoes at that point, I don't know that I'd done as much as you. And maybe I wasn't as hungry, or I'd been around it so much, but your drive and passion for learning has always impressed me. So kudos to you there. So when you do return and get those initials behind your name, is there anything that you're looking forward to most or excited about?
Yeah, I'm really excited to be able to put into practice like what I've worked so hard for, I feel like my life's kind of, in a way, it's been put on hold for vet school, which is the most challenging but also rewarding thing I have ever done. So I can't wait to actually be able to apply the skills that I've learned and feel like a doctor and not a student.
Right. And for those of you that don't know, vet school is 4 years.
Yes.
And it usually takes an undergrad degree to get in, which is another 4 years.
Most of the time.
I think there was one kid in our class that didn't have a bachelor's. He got accepted his third year.
We had one in our class as
well. So that's less than 1%. And the other thing is, most of the people going into vet school, they know like from basically high school. If they want to do that, they've got to put their nose to the grindstone, and you can't just skate by to get in because they don't let just anybody in.
No, they don't. It's a very rigorous interview process and application that you have to go through.
Yeah, and how many vet schools did you apply to?
I applied to 6.
And how many did you get interviews at?
I got interviews at 3.
Yeah, so that's half, 50% for those of you keeping track at home, if my math is correct. I remember my brother, who you know, who's probably one of the only specialists in his field. He didn't get in vet school his first time because they said he didn't have enough experience. So I don't know if there's flawed interview practices or what, or if they've changed that with the new curriculum. He was working as a farrier, worked for my dad, but they said he didn't have enough other experience besides horses. So he actually went to a dairy farm and worked for a year, and then he got in the next year. And he continued shoeing too.
I think they still tell people that they don't have enough experience. Certain schools require a number of hours. Illinois did not require a certain number. They suggested, I believe, when I applied. I don't know if that's changed. But definitely getting lots of experience and preparing yourself for vet school from even in high school till when you graduate high school is important.
Yeah, because, I mean, the grades still matter, right?
The grades matter some. You have to have a consistent GPA, not a 4.0. I didn't have a 4.0, and I got into vet school.
Yeah, and your undergrad, where did you go for that?
I did 2 years at Kaskaskia College on a soccer scholarship, and then I did 2 years at Murray.
Okay, is Kaskaskia junior college?
Yes.
Okay, that's what I did too. That's what my dad did, and that's what my brother did. I think in my organic chemistry class, there was 3 of us. And I don't think I would have passed that class if there was 300, like there was at a big university.
I actually had to take my organic chemistry class at Murray at
really?
a university, and it was the fall of 2020, and we were only allowed to go to class every other day due to the amount of students and COVID restrictions. And at that point, I was like, do I really want to be a vet? Like, this class is killing me. And I thought I was going to fail it. But I came out doing really well in the class. But it was definitely a challenge that I had to overcome and learn how to study differently. And I had never had that issue before.
Yeah. Do you remember anything from organic chemistry?
Not very much.
No, I remember little, except there was only 3 of us, and he graded on a curve, and that's how I passed. He would literally come in and sit down at a desk with us, and the 3 of us would sit around. I remember we made Tylenol or something. Tylenol and caffeine, which maybe that was a sign because that's what we tend to run on as equine vets someday.
That's true, too.
So the soccer scholarship, that had to be challenging.
It was challenging, but rewarding. I'd played sports throughout high school, and so it definitely gave me that friendship and team that I had through high school. And it gives you a lot of responsibility. You have to be able to work with your teammates. Like, we work together quite well at the clinic, and it teaches you how to have sportsmanship and study, and you have to study well.
Yeah, you got to make the most of the time you study.
Yes.
Like I said, my brother still shod horses all through vet school. I decided an easier way for me to make money was to play guitar in bands and in bars on the weekend. And that, it seemed, of course, my dad, you got to quit that for vet school. But it seemed to me the weekends I knew we were playing, like where other students knew they had a weekend of whatever, they tended to maybe go out or kind of push and procrastinate. So I knew the weekends I had gigs, I was busy, and that my time management was super important. So I felt like when I knew I had stuff to do, I actually did a little bit better. I guess I worked better with a deadline or under pressure.
I felt that way too. I really liked having something to look forward to on the weekend as more a break. Like, if I work really hard all week, stay up late and study, then I can go to a horse show on the weekend, or I could work in the Therio ward on the weekend.
Yeah. So what was your study habits through vet school the first 3 years?
The first 8 weeks was drastic change for me. I feel like I've always had good study habits throughout school, and I had to go from spending a couple hours to prepare for an exam to spending like weeks to prepare for my vet school exam.
Yeah. That was my experience too. I wasn't like overly smart, but I worked pretty hard. And I thought I studied pretty hard until we got to vet school, and it was a whole different ball game to me.
I thought the same thing.
Yeah,
And then I got my first exam grade back.
how was that?
It was not good, and I was so disappointed.
Did you fail?
I did. My first vet school exam, I did fail it.
Did you tell your mom?
I did.
And how did she respond?
She did not respond too well to that. But I think the point to take from it is, like, I came back and my grades were better than ever. And you just have to figure out what works for you. And they know that your first vet school exam is not going to be the best. Like, you don't even know what to expect. It's completely different than any other exam. Our exams are 3 hours long, and nothing in undergrad prepared me to take those exams.
Yeah, I was the exact same way. I think my most challenging class in undergrad was like a freshman economics class I had to take as a junior. One, I wasn't really interested in it, but two, just that many people in there, and the tests were different, and I don't think the professor really cared. Do you find that most of the teachers in vet school do care and really want you to learn it, or they're just there to give their lecture and give their test
I think it
questions?
depends on the professor. There's probably a few professors I can name that actually care. And one of them, I went to our class coordinator after my first exam, and I was like, what happened? Like, I've never had this happen to me. And he helped me figure out how I needed to study differently for vet school. I had to write things out a lot more, spend a lot more time on it, and the amount of material is just huge compared to what you learn in undergrad in a shorter time that you have to remember and test over.
Yeah, it's truly overwhelming, the amount of stuff they throw at you.
They say it's like drinking from a fire hose, and I
Yeah.
can concur with that.
That's what it feels like, and it usually felt like it hit me in the face, and I just toppled over. And then I remember in the exams, I'd be like a quarter or halfway through, and there's always that one student that stood up, done. I remember third year, you still in the auditorium?
Yes.
Yeah, so it's kind of like stadium seating, and there was always one or two kids that finished in like record time, and then you're like, did they just give up, mark all C's, or were they that smart and you didn't know whether to give them a high five or trip them as they went down the steps because you were still
clink
stuck?
The steps, they're so loud in that auditorium still, and they let students let their chairs swap up, and it's very distracting in that room.
We had a girl in our class, I won't mention her name, but the Tupperware containers that snap,
Yeah.
she would bring those. They were glass, and they had 4 snaps, and they were very loud. She would unsnap them individually, get one carrot out, snap them back, chomp on the carrot, and then do it again.
That had to be so frustrating.
Yeah, I wanted to stab her with a pencil. But I guess she's still a vet now. So you've mentioned the Theorio Lab a lot, and I did a lot of repro where I did my internship, and we still do a bunch of AI and everything, but like anything else in veterinary medicine, we learn stuff every year from people doing research, from continuing education, for the AAEP convention, online CE. And I don't want to say I fell behind. We still do pretty good at repro, but one thing I have learned from you coming back is all the newer stuff that you've taught me, especially like some new stuff that's out there that I'm just not aware of. So is there anything really cool going on in the repro world you want to talk about or that I need to know about?
I don't know that I'm that knowledgeable about it, but I do have a passion for it, and continuing education is definitely great to still learn. But I did learn about an infusion that we can give with antimicrobial peptides after we AI that I hadn't heard about before, and one of my fellow classmates actually got to AI her mare last year and had a baby, and she used it on a maiden mare. For those people who don't know, it's a mare who's never had a baby before. And after, about 11 years, the cervix starts to get fibrotic. So that's kind of a big deal in our world for repro. And she was able to get her mare pregnant, so that was really great. And I would like to implement it and try it. And we have a couple problem mares
Couple.
that I think it would be nice to try on and implement for sure.
Yeah, that's the stuff you were showing me the other day. Right?
Yes.
Yeah, we're going to order some of that and try it for sure. Because the older mares are pretty problematic, and a lot of it's that the cervix and the inflammation we get after breeding, whether it's natural cover if they can or AI. So that's going to be a game changer,
Yeah.
I think. And I think the huge trend with the weight loss peptides like the Ozempic and all that stuff now. I mean, I think we're going to see some stuff like that pop up in our world. You know, we got a lot of overweight horses. I don't know. I haven't read
Yeah.
anything yet about that, but it could be quite interesting over the next few years of what we can extrapolate from the human side with horses with like the metabolic syndrome, the fat foundered horses.
Yeah, we've already got quite a few products from the human side in veterinary medicine now, even that we use in the clinic today.
Yeah,
So,
we got most of the joint injection stuff's all human stuff because that's where the money's at to research it, right? Is these
Yeah.
top level athletes and everything. And we were talking about it in the ulcer lecture about giving horses time off and letting them be horses. And me and Dad were having this conversation the other day with Steve, and it's, you know, there's a reason there's an off season for sports,
yes,
but it's
thankfully.
yeah. I mean, you probably experienced that playing soccer too,
Yeah.
but that's hard to get in the heads of a lot of our people that compete too, that spend a ton of money on their horses, a ton of money on vet bills just to kick one out and let it be a horse for weeks or months at a time. So with your horse, you gave him time off.
I did.
Did your mom continue to show him, or is he just allowed to
No,
be a horse?
Both of our horses were allowed to be horses
Yeah.
for almost 3 months.
Yeah. What'd you notice after they came back?
After he came back, I noticed a huge difference in his willingness. I felt like he was so much more ready and he wanted to do it as much as I did and was super responsive when I was riding him. And we actually placed in the top 23 times out of 91 teams in an open class. And I hadn't placed in an open class like that before. So
Yeah, and that's
definitely came back stronger.
team sorting.
Yeah, that's team sorting.
Can you explain team sorting?
Yeah.
And then explain team penning, because I still get them confused.
Yeah, I can explain them. So for team sorting, you have like an hourglass shape pen, and you have a partner. In most of the cases, they do have one man sorting, but that's a completely different thing. So for team sorting, you have 2 people. One person guards the gate, like where the hourglass narrows in the center, and then another person will go into a herd of 10 cows, and as the person enters the pen, then the judge will call out a number. The cows are numbered on their backs from 0 to 9. And so the judge will call out a number, and you have to get that cow and get it into the other side of the hourglass without letting any other cows through. And then you trade off with your partner, and you guard the gate to make sure no other cows get through, and they have to go get the next sequential number.
Okay. Do the judges look at the cow before they call them, or is it just random?
Pretty random.
Yeah. And then that's sorting. So what's the difference
That's
between that
sorting.
and pinning?
Yeah, so penning, there's 2 different types of penning, but actual team penning has 30 head of cows in the back, and they'll call out, you have a pen on the other side of the arena, and you actually have to run like number 3 cows down to the other end of the pen and put them in a small corral.
Okay.
And you have 3 people that team pen with you.
Okay. So both of those are kind of real life practical stuff on ranches, but in their
Yes.
own way. Yeah, that's really cool. They're fun to watch. I've always wanted to try, but I'm afraid I'll fall off. And my horses are old.
You have a old sorting horse to try. I
Yeah,
think you could do it.
Yeah, we got to sound her up first. So I always tell people that like our lab is full of equipment that didn't even exist when the building was built. Our digital x-rays, I mean, we take an x-ray and we get a sharp image on a 65-inch TV within seconds. Where Do you see anything, or they told you anything in school about any trends in technology that's exciting coming up, like the new PET scan or anything?
No, they haven't really talked about that. I don't feel like you get exposure to that in vet school as much. When you go other places, I feel like you get to see the nice new technology. Like when I went to AEP and got to see some new technology there, which was pretty cool. So I'm definitely excited to see what new technology is going to come out from now till I graduate and even after for us to use.
Yeah, I think it's going to be exciting. I was telling an old trainer the other day, or older trainer, that it's a super exciting time to be an old horse because we have more than just steroids to throw in joints. We have stuff we can help actually fix things and heal things and image things better. I was watching a video the other day. They were scoping a coffin joint in a standing horse and actually looking at the cartilage and getting a really good picture. So
That is really cool. Maybe
Yeah,
we can do that one day.
yeah, I hope so. They just block the horse and just like they'd inject it. And the surgeon was talking about how much more they could see with the horse actually bearing weight on it versus laying down on their backs like they traditionally do it. So, I think veterinarians as a whole are getting a little braver on some of the stuff we'll try. And with the technology, we can get away with it. So that's going to be super exciting, I think, with all the different technology. And even the 12 years I've been out, it's changed so much. And it's going to be crazy to where it goes. So we mentioned earlier in a previous podcast about one of our core values at the clinic is improving the welfare of the horse through client education. And I really like, as a vet, to explain to clients what our thought process is and why we're doing what we're doing and the reason behind it. And we do put on a few educational events through the year. And I know you like planning events.
I do like planning events.
So do you have anything you're thinking of that we could do for kind of some community engagement or education when you come back? Because it's tough now being the only vet to be working and planning this stuff, but I would like in the future to do way more educational stuff. So I'd be interested to know if you got anything.
Yeah, I would
brewing.
definitely be willing to work with you on those. I think it would be really cool to have a mare and foal educational meeting and what is normal for a foal and what is not. We have more clients every year who are just getting into breeding or have a mare that they're truly passionate about that they would like to have a baby out of. And a lot of people don't know what to expect when a mare foals. And we have some great documents that we've put together for the clinic already. But I think it would be super nice to have an actual educational meeting on what to expect for a mare and foal.
What to expect when your mare is expecting.
Yes, that's a great title.
That would probably make a good YouTube video too.
It would.
And then we should require people to watch it before they even think about breeding their horse. Because babies are a whole different ball game. I know in the springtime, the university is probably full of critical babies.
Very. And we get to actually take care of some of those babies through our AEP club.
Oh, that's cool. And the AAP is the American Association of Equine Practitioners.
Yes.
And you're in the student chapter of it. Yeah, and that's a great community with all kinds of
I've met
education for vets.
So many wonderful equine veterinarians through AEP.
And you got to go to the annual convention
and
last year?
And I got to go to the annual convention as my first one.
Which was Orlando, right?
It was in Orlando, yes.
Was there anything super exciting there?
Yeah, my friend and I that went participated in the extended student program, which we met several veterinarians through and got to go through. There was 3 different stations that we went through, lameness, colic, and I'm trying to remember what the third one is. Oh, acupuncture, which
really?
I really liked.
Did you try it on a horse or a person?
I tried it on myself, yeah.
Like with a real needle?
With a real needle.
I've always been scared of that.
It wasn't that bad.
Where did you?
I acupunctured my thumb right here.
Oh, I've heard a long time ago somebody tell me if you got a headache.
You do have a pressure point, yeah, and it works.
Does it?
It does work.
Maybe we should try that. I've seen some when I was a student. When I did an externship at like Root and Riddle, there was a lady that was big into that, and that's kind of, what do they call it? Eastern, or what is it? Eastern medicine? Yeah. So I think it's again a whole whole horse approach. I don't think it's going to, fix kidney disease.
Yeah, I think it's
But-
really nice to use in conjunction with the medicine that we already practice.
So maybe that's something we need to look into. I know our laser has an acupuncture setting, but I haven't really played with it too much.
I'd like to go and get certified in acupuncture
And where
maybe once I graduate.
do you do that? Who certifies you?
There is Chi University, and it's actually in Orlando.
Oh, okay. Is that who was down there, or was just a vet teaching?
It was just a vet who had graduated from Chi that was working with us.
Is that a very long program, or?
I believe it's about 8 weeks total. You can do a week at a time, similar to chiropractic school as well.
Probably pretty intense, 8 weeks, though, I would
Yes.
imagine.
There was a student actually who was doing it while she was in her 4th year, and I could not imagine doing that on top
No.
of what we already do.
Yeah, I'm pretty good at the nerves and the legs, but once you get above that, it's all just kind of a mumble jumble to me.
And all the different points have different names too.
Yeah, we need one of those little models with the little dots that show us where to put them. So we've talked a lot about vet school itself. If there's any vet students looking to this, whether they've already got in or they're wanting to go to vet school, is there anything you would tell them? Or if you could sit down with yourself 3 years ago before you got in, what would you tell yourself before you tackled this great adventure?
Yeah, so I would tell myself that it's definitely going to be a really long road, and you're going to have lots of challenges throughout life, and you're away from home, and you have to commit more time than ever to school. So you miss out on some of the family things at home. But that pays off in the end because your family is who supports you and gets you through vet school. I don't know what I would do without my family and friends and the great mentorship that you have provided me to get through vet school. So definitely have a really good support system, and then know that it's not all just about your grades in vet school. Grades are important. You want to do well in vet school, but one bad exam is okay.
Yeah, what's the saying? C's get degrees, right?
These degrees.
Yeah,
What do they call the last person in the class who graduates?
a vet.
Doctor.
Doctor, that's right. I remember one of our exams had, what temperature do you incubate an ostrich egg at? I still don't know, and I still don't really care. But
I
that was an
couldn't tell
exam
you that.
question. Oh, well, is there anything else you want to tell us about vet school or Champaign besides the wind and the cold and the snow?
Yeah, it's very cold and very windy, but it is beautiful in the summer, and there's some really nice parks in the area that I enjoy walking my dog at, and just a nice break to get away. And I found some favorite restaurants up there that I think I will go back and visit. The sports teams are great, even though I haven't been to a game. I choose to go ride horses on the weekends instead of go to basketball games, even though I like basketball. But there's something for everybody in Champaign, and the school is great. Once you get through it and get to know the professors, the connections in school are what make it worthwhile, and your friends. So definitely put yourself out there, take advantage of all the clubs that are offered, and just stay engaged.
Yeah, because Dr. Scott Austin's still up there, Dr. Pam Wilkins,
Yes.
Dr. Gutierrez, and those are ones that taught me through there. And they will still save my butt in the middle of the night on some medicine case or something that's surgical. And it's so important to have great professors like that and have relationships with them, whether it's vet school or whatever. I mean, that's just,
Yeah, they're so great. Dr. Austin went to AEP convention with us, and it is really nice just to have such a great advisor as Dr. Austin, and then have him as a clinician and professor at school as well.
yeah, he saved my butt on a lot of weird stuff that comes in that I've never seen before.
He tells us that we refer him some really weird cases.
Yeah, and I guess we just attract it down here in Southern Illinois. I'm not sure.
I guess.
We're kind of like a magnet for the weird stuff. And I'll send stuff to him and be like, I've never seen that before. It's like, well, if you haven't seen it, I've definitely never seen this. But yeah, shout out to all the mentors out there that are helping younger vets like me get through all this stuff and giving guidance to young ones like Jenny. We're super excited for her to come back. So one final question is, who are you listening to right now? What singer?
What singer am I listening
Yeah.
to? Oh, I have no idea. I'd have to look at my phone, to be honest with you. I haven't listened to a lot of music recently. I listen to more music when I'm at school studying. But I would say one of the most recent that I've started listening to is Zach Top.
I knew you were going to say that.
I got to go see him in concert, so
Yeah, he's good.
he is really good.
I like him. He's the real deal.
Kind of looks like my cousin, you know?
He does.
He looks like Cody.
He does. I wonder if he can ride a bronc like your cousin.
I wonder if he can, too.
I don't think he can. But
I
he
don't
can
think
play.
my cousin can play a guitar like he does
I
either.
can't play a guitar like Zach Top either, but that's okay. We can work on horses better than Zach, so we got one on him there.
Yeah, we do.
But all right, well, I think that's going to wrap up this. Thank you again, Jenny, for joining us in the studio. And we'll be doing more of these as you're coming back, and maybe you can host some of these someday too. And thanks again to our friends at Just Say Hey for letting us take over their studio and all the help with this stuff. If you have any questions or comments or concerns, go look us up on Facebook and shoot John a message on there. Don't forget about our YouTube channel. And until next time, take care of your horses and yourself.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your